Speed, Agility, and Quickness Training. The purpose of this presentation is to provide the fitness professional with a foundational overview of concepts and application for speed, agility, and quickness training. Following this presentation, the participant will be able to describe speed, agility, and quickness training and its purpose, rationalize the importance of speed, agility, and quickness training, design a speed, agility, and quickness training program for clients in any level of training, perform, describe, and instruct various speed, agility, and quickness training exercises. Speed, agility, and quickness training is often viewed as being beneficial only for the athlete. However, by using the proper progression as seen in the OPT model, the health and fitness professional can effectively use SAQ training to add intensity and complexity, increase the cardiorespiratory demand, and provide a simple and exciting variety to a routine workout. Speed, agility, and quickness defined. First, starting with speed. Speed is the ability to move the body in one intended direction as fast as possible. It is the product of stride rate and stride length. Stride rate is the number of strides taken in a given amount of time or distance. It may be improved with proper core strength, reactive training, and technique. Stride length is the distance covered in one stride during running. Proper running mechanics allow the client to maximize forces generated by muscles so that maximum velocity can be achieved in the shortest possible time. This includes front-side and backside mechanics. Front-side mechanics is the emphasis on triple flexion of the front leg. Triple flexion includes the actions of ankle dorsiflexion, knee flexion, hip flexion, and keeping the lumbar spine neutral. Backside mechanics is the emphasis on triple extension of the back leg. Triple extension includes the actions of ankle plantar flexion, knee extension, hip extension, and keeping the lumbar spine neutral. Agility. Agility is the ability to start or accelerate, stop or decelerate and stabilize, and change direction quickly while maintaining proper posture. This requires high levels of neuromuscular efficiency because the client is constantly regaining a center of gravity over his or her base of support while changing directions at various speeds. Proper agility training can also help to prevent injury by enhancing the body's ability to effectively control eccentric forces in all planes of motion, as well as by improving the structural integrity of the connective tissue. Quickness, or reaction time, is the ability to react and change body position with maximum rate of force production in all planes of motion and from all body positions during functional activities. Quickness involves the ability to react to visual, auditory, and kinesthetic feedback during functional activities with minimal hesitation. Speed, agility, and quickness drills. Proper technique for quickness drills should be as follows. Foot-ankle complex, pointing straight ahead and dorsiflexed when it hits the ground. Excessive flattening or external rotation of the foot will create abnormal stress throughout the rest of the kinetic chain and decrease overall performance. Knee complex, must remain straight ahead. Excessive adduction and internal rotation of the femur during the stance phase decreases force production and leads to overuse injuries. Lumbopelvic hip complex. The body should have a slight lean during acceleration. During maximum velocity, the lumbopelvic hip complex should be fairly neutral, without excessive extension or flexion, unless to reach for an object. Head position. The head should remain in line with the lumbopelvic hip complex and legs. Should not compensate and move into extension unless necessary to track an object, such as a ball. This can affect the position of the lumbopelvic hip complex via the pelvo-ocular reflex. Some basic speed, agility, and quickness drills include speed ladder drills and cone drills. Let's first start with speed ladder drills. Make sure that with all of these drills that the individual maintains ideal alignment throughout the kinetic chain checkpoints. The first drill is a 1-in, meaning that 1 foot goes into each box. The second drill is a 2-in, meaning that 2 feet go into each box. The third drill is a side shuffle. The fourth drill is an in, out. The fifth drill is a zigzag. The sixth drill is an alley shuffle. Now we'll review the cone drills. As with the speed ladder drills, make sure that ideal alignment of the kinetic chain is maintained. The first drill is the 5-10-5 drill, named as such because you'll start by running 5 yards to the first cone, turn and run 10 yards to the second cone, and finish by running 5 yards back to the middle cone. The second drill is the box drill. This is performed by running 10 yards to the first cone, side shuffling 10 yards to the second cone, backpedaling 10 yards to the third cone, and side shuffling 10 yards to the starting cone. The side shuffling components of this drill can also be substituted with a karaoke pattern as well. The third drill is the T drill. Sprint 5 yards to the center cone, side shuffle 5 yards to one of the side cones, side shuffle 10 yards to the opposite side cone, side shuffle 5 yards back to the center cone, then backpedal 5 yards back to the starting cone. As with the box drill, the side shuffling portion of the T drill can be substituted with a karaoke pattern as well. The final drill is a left drill. Sprint 10 yards to the second cone, backpedal back to the first cone, side shuffle back to the second cone, side shuffle again to the first cone, karaoke back to the second cone, karaoke again to the first cone, then sprint back to the second cone to complete the drill. Now that we've reviewed example speed, agility, and quickness drills, we'll next discuss designing the speed, agility, and quickness training portion of one's program. Keep in mind, these drills are an optional component of an individual's program and should only be used if it is consistent with the individual's goals, for example, general performance or caloric expenditure, and their physical capabilities. Implementing a speed, agility, and quickness training program requires that health and fitness professionals follow the progression of the OPT model through a gradual increase in volume. For example, if a client is in the stabilization level of training, or Phase 1, select 4 to 6 speed ladder drills and/or 1 to 2 cone drills. For a client in the strength level of training, Phases 2, 3, and 4, a health and fitness professional can select 6 to 9 speed ladder drills and 1 to 2 cone drills. For an advanced client in the power level, or Phase 5, select 6 to 9 speed ladder drills and 2 to 4 cone drills. You can also refer to the table in your textbook for the appropriate acute variables for each phase of training. In summary, similar to reactive training, the programming component of speed, agility, and quickness training follows the same concepts of the integrated performance paradigm. It can add intensity, complexity, cardiorespiratory demand, and variety to a routine workout for regular clients as well as athletes. It enhances proprioceptive acceleration, deceleration, and dynamic stabilization of the entire body during higher velocity movements. Speed is the ability to move the body in one intended direction as fast as possible. Agility refers to short bursts of movement that involve change of direction. Quickness is the ability to react to a stimulus and change the motion of the body with maximum rate of force production in all planes of motion and from all body positions during functional activities. A client's core, balance, and reactive capabilities will determine the success and safety of the program. Precise technique and kinetic chain control are required to minimize risk of injury.